Well, thanks again, everyone, for being here today for the Iowa Hunger Coalition May 2025 monthly meetup. My name is Luke Elzinga. I'm the Policy and Advocacy Manager at the DMARC Food Pantry Network in Des Moines, and I also serve as the board chair of the Iowa Hunger Coalition. If you're not familiar with IHC, we are a membership-based 501c4 organization. We have a volunteer board of directors, no paid staff, but we do work with a contract lobbyist, Peterson Consulting. And we try to really bring individuals and organizations together to advocate for solutions for hunger and food insecurity in Iowa. This is our mission and guiding principles. Our mission is working to end hunger in Iowa through education, advocacy, and policy change rooted in justice. And our three guiding principles are hunger is a policy choice, nutritious food is a human right, and ending hunger requires solidarity, not just charity. If you'd like to learn more about any of those guiding principles, you can visit our website, and right there on the homepage has a little more information. So, like I said, we've got a lot to cover today. Before I jump into it, just to know, if you have questions, please feel free, raise your hand, put them in the chat. I'm going to do my best to monitor that. If I use an acronym that you don't know what it means, please ask questions. I'm sure some people may have those same questions. So, for those of you who didn't know, the state of Iowa did wrap up its legislative session for 2025, and I will start with the good news. So the good news is the Choose Iowa Food Purchasing Program was made a permanent program and received a $200,000 state appropriation. This is a relatively new program. It was a pilot program last year, but it provides matching funds for food banks and emergency feeding organizations to purchase local food, and specifically food through the Choose Iowa program. It's kind of the state of Iowa's, grown in Iowa marketing brand. They have to be a Choose Iowa member, and it has to be purchases of items like fresh fruits and vegetables, meat, dairy, eggs. And this year they did add grains and flours to that list as well. That's the best news. Other good news is we did stop harmful legislation that would have rewritten school nutrition standards. So you may have been following this. It was Senate File 525 in the Senate, and it was House File, I want to say 851. I may have gotten that wrong, but it did pass the House, stalled in the Senate, and ultimately that legislation did not pass before the legislative session was over. So now for the bad news. The Choose Iowa Food Purchasing Program, like I said, it was made permanent. It actually received $100,000 less funding than it received last year. The first year of the pilot with $300,000. This year it's $200,000, and schools were cut out of the program as eligible beneficiaries. So last year, and actually the school funding is kind of still, I think, being determined who it's going to be sent out to, and that's going to go out this fall. But going forward, this program for the next fiscal year is just for food banks and emergency feeding organizations, and it's not clear which organizations, because this is less funding even for the food banks and those organizations than last year. Double Up Food Bucks, once again, did not receive a state appropriation. If you're not familiar with Double Up Food Bucks, this is a program that has been active in the state of Iowa since 2016. It's administered by the Iowa Healthiest State Initiative. It's a nutrition incentive program for folks on SNAP. They can double up their benefits if they're purchasing fresh fruits and vegetables. I want to be clear, it's not the case that Double Up is now going away. It just did not receive a state appropriation. Double Up Food Bucks has never received a state appropriation. Since 2016, it's been funded through private donors and a federal matching fund, the Gus Schumacher Nutrition Incentive Program, GUSNIP. And so it's been privately and federally funded, and we've been working on getting a state appropriation, which would then increase that federal match for something like 6 or 7 years now. And pretty much every year we're told there's not enough room in the budget, maybe next year. I also want to be clear, this was a very bipartisan program. We had a bill introduced in the House that had half of the House Republican caucus as co-sponsors. Ultimately, what we did not see there was the political willpower specifically from the Senate. The House had it in its HHS budget. The Senate did not, and ultimately it did not make through negotiations. Also, despite strong progress, the Grocery Reinvestment Fund and Produce Processing Grant Bill did not cross the finish line, came extremely close. Actually, the funding was included, but it was contingent upon the policy bill being passed by the Senate, which did not happen. But again, another bipartisan proposal, very popular, just with all the competing priorities, did not make it across the finish line. And obviously, we saw no progress on healthy school meals for all policies or summer EBT legislation. The legislature, at the very last minute, did pass Medicaid work requirements, which I will note the governor has already requested a waiver to do that. But they did pass these Medicaid work requirements, and that legislation includes a division that talks about aligning work requirements with public assistance programs and specifically calls out SNAP. We're still not sure if that will have any impact on the program. The fiscal note said that it likely did not, but also that HHS did not respond to requests for comments. So it's a little unclear. We'll have to see when the rules come out if that will impact SNAP at all. And finally, while we were able to stop legislation that would have restricted certain foods and beverages from SNAP, our governor has unilaterally requested a waiver from USDA to do so, and actually had already requested that waiver before the bill was even introduced. All right, I'm going to pause for any questions on state legislative updates. Does anyone have any questions on bills, whether they made it through or did not, or any questions about any of the priorities I talked about?
I have a question, Luke.
Yeah, go ahead.
Is there any chance that this current USDA might okay that or pass that waiver?
There is a very high likelihood that they will.
Okay,
Prior to this second Trump administration, USDA had never granted that type of restriction waiver, even under the first Trump administration. There were multiple attempts and they didn't get granted. But I think we knew that things were going to be different this time around. I think, especially with RFK Jr. and some of the Make America Healthy Again rhetoric. RFK Jr. and USDA Secretary Rollins wrote a joint op-ed about encouraging states to do this. Secretary Rollins actually sent a letter to state agencies encouraging to submit these waivers and saying we will grant them. And I think it was yesterday that the news went out that actually the first waiver of this type has been granted for Nebraska.
okay.
And I believe that one is just a soda restriction.
Yikes. Okay, thank you.
I will touch more on that in just a second. Any other questions about the state legislature? All right. Well, I do have a couple other state policy updates that I alluded to. And the first of those is this SNAP waiver request. So Iowa Public Radio broke this story, I think last week. We had heard rumors, maybe going on a month, that Iowa had submitted something and we're trying to get our hands on it. IPR broke that story. We did issue a statement. I'm sorry, I don't have the link here, but if someone else maybe on the IHC board wants to find that statement and drop a link in the chat, or I will in a minute. But IPR broke the news. We still have not seen any comment from the governor. I believe the HHS spokesperson did put out a short statement in response. But what we learned is that a couple months back on March 12th, Kim Reynolds sent a letter to USDA indicating that Iowa is submitting a waiver to restrict certain food and beverages from SNAP. It wasn't clear if that letter was the waiver request itself or just kind of a notice of intent. The specific guidelines of the waiver. Iowa is wanting to ban any food and beverage that is subject to the state sales tax from SNAP. So most foods and beverages in the state of Iowa are sales tax exempt, but there are some that are subject to the state sales tax. I think my guess is why they use this is it's probably easier for retailers to implement because there's already something in the system that needs to designate whether items are sales tax exempt or not. I think they saw that as an easy way to also designate whether they'd be eligible for purchase with SNAP. So this is largely a candy and soda ban. There are some very weird oddities. This would also ban seeds and food producing plants from purchase with SNAP. The candy ban specifically, there's this phrase around certain percentages of flour. So, like, actually, granola bars would be banned as well if they don't have any flour. It's not just soda. It's a lot of other beverages, things like lemonade, fruit punch, anything that has less than 50% juice. Items like coffee and tea are separate from that. They're still being able to be purchased, but I should really have put the link here. But if you search just sales tax exempt food Iowa, you will find that list of what those items are. And again, we haven't heard anything officially from USDA on if they are going to grant this. I think it's likely they will. There may be some tweaks. I'm not sure. But if approved, this waiver would go into effect January 1st, 2026. We also don't know if there will be any period for public comment on this at all, but we'll keep you all updated in the know on that. Are there any questions on this SNAP waiver request? All right. Well, the next kind of development from the state of Iowa, and this actually news broke on this before this waiver request, the Healthy Kids Iowa program, which is being billed as an alternative to summer EBT that aims to provide $40 worth of food for pickup at food pantries and meal sites each month during the summer. So if you haven't been, following us for the past couple years, we have really been pushing the state of Iowa to participate in the summer EBT program, which is a relatively new federal nutrition program that provides $40 per month in grocery benefits through an EBT card to kids who qualify for free or reduced price lunch during the summer. So it's 3 months of that $40. So it's essentially $120 in nutrition benefits per child over the summer. Iowa has not participated, but we have submitted these waiver requests to try and do our own thing. This was initially rejected under the Biden administration. Iowa said it would, resubmit this under the Trump administration. And we got news that this project had been approved. Now, I want to be clear, this is not a summer EBT waiver. Even if they're talking about it as an alternative, this is not waiving, the summer EBT law and giving us the same amount of funds. What this actually is it's $9.1 million in USDA summer feeding demonstration project funding. That is the same pool of funding that was used on summer EBT evaluation projects back in the 2010s to look at that concept. It aims to assist 65,000 kids, which is a lot less than the 245,000 that would have been assisted through summer EBT. We're not exactly sure where this number came from, but based on some of the numbers and the county numbers that have been shared, we think it's safe to say that they are aiming to assist 1/3 of the kids who qualify for free and reduced price lunch through this program. Um, so again, those are the impacts. We know it's going to have less of an impact than summer EBT. We have a lot of questions. Um, this is supposed to start in June, so very quickly. I will just share that DMARC, where I work, I believe is going to be hosting one of these sites, and some of our partners as well. A couple other IHC board member organizations are. Um, we still have a lot of questions. But if anyone has questions about this, I will do my best to answer it right now. And if you have other questions that I can't answer, I would love to collect those to be able to ask those of HHS. Does anyone have questions about this Healthy Kids Iowa program? I will do my best to answer.
I have a question again, Luke. If I
Yeah,
was waiting, I didn't hear anybody. Um, or forgive me if somebody's hand is up. No? Okay.
I think you're
Um,
fine. Yep.
so do you have any information on how the 65,000 or 1/3 are going to be selected?
No,
Okay,
we don't know how those limits are going to be imposed. It it does not seem like there is going to be an application process for this. It's simply here's the sites that you can visit. Um, and some sites may be open once per month, some may be open more often. I think it'll probably look different at every site. But that's something we're not clear on, is what happens if we run out of food and there are more people there asking for this. It's not clear.
yes, thank you.
All right. Well, if you have any other questions about this, please don't hesitate to reach out. Shoot us an email at iowahungercoalition@gmail.com. This is something that we're going to be spending a lot of time on this summer, understanding the impact of this program. So stay tuned for more information. Last thing I will add, if you visit the Healthy Kids Iowa website, there's a place where you can sign up for email updates from the state as well. And I would encourage you to do that if you are wanting to get the latest news and updates from the state on this program. Last thing I wanted to add on the state side before we move into federal, this was just news that broke. Um, the USDA sent a directive out to states requesting that they share SNAP client data with USDA, and it seemed like was maybe coming from Doge. What we know at this point is that Iowa is one of at least 4 states, along with Alaska, Indiana, and Ohio, that plans to comply with this federal directive or may have already complied and handed that data over. There are a lot of states that have serious legal concerns about this. I think is likely to be a lawsuit about this, especially with some of our state data, consumer protection privacies. So more to come on that. We don't have a ton of news to share, but just wanted to make everyone aware of it. All right, we are going to be shifting now to federal advocacy updates, but I want to pause just a second to see if there's any questions on state issues first. All right, federal advocacy updates. There's a lot going on right now, especially this week. If you have not been following this, Right now, Congress is working on what's being billed as the one big beautiful bill that is going through the reconciliation process. And I won't get into the weeds of all this, nor do I really even know all the ins and outs of this. But the budget reconciliation process is a process that allows um, the Congress to move a package of legislation um, that is essentially, doesn't require the 60 plus votes in the Senate. It's filibuster proof. So it just requires a simple majority in both the House and the Senate. And the House and the Senate have been working on trying to advance this, again, one big, beautiful bill package that would be, some massive cuts to programs like SNAP and Medicaid, and in addition, doing some massive tax breaks for the wealthy. So, I think when you joined us last, we knew kind of what the scope of the cuts wasn't going to be. We knew what the scope was going to be, but not the specifics. We know what those specifics are now, and I'm going to run through those. The House budget reconciliation bill includes about $295 billion in cuts to SNAP. That's about 30% of SNAP funding over the next 10 years. This would be the largest cut to SNAP in the history of the program. A lot of where those cuts are happening is a cost shift of tens, hundreds of millions of dollars in benefits costs and additional administrative costs to the states. I'll go over all of this in a bit further detail in just a second. It would expand work reporting requirements for older adults and parents and caregivers of children ages 7 plus. It would kick refugees and asylees off the program. It eliminates SNAP Ed, and it freezes future reevaluations to the Thrifty Food Plan, which would cut future benefit amounts. So perhaps the most harmful proposal out of all of these, although I don't know, it's tough competition, um, shifting the cost of benefits to the states would be absolutely devastating. And this is probably the wonkiest part. So bear with me. Currently, states don't pay any of the benefit costs of SNAP, and they have a 50% share on administrative costs for the program. What the House Budget Reconciliation Bill proposes is shifting an additional 25% of the admin costs to states. So states would be on the hook for 75% of those admin funds. And that would be immediate. So in Iowa, that would be an additional $15 million that our state would need to come up with to administer SNAP. That would come out of our HHS budget. You may have recalled me just a minute ago talking about how we've been struggling to get a $1 million appropriation out of that budget for going on like 6 or 7 years. 15 million would be a big hit. What would be an even larger hit is beginning in fiscal year 2028, states would be on the hook for 5% of the benefit costs as well. That's currently 0%. States would also face even higher cost shares based on their payment error rate, which, because of another policy that's in here, is likely to increase those payment error rates and would force states into the higher benefit share. So right now, Iowa's payment error rate this past year was 5.2%, which is low enough to have us only paying that 5% benefit share. But if that percentage went up even 0.3%, it would kick us to that 15% benefit share. And I think it's very likely that Iowa would be on the hook for at least $80 million annually in SNAP benefit costs starting in fiscal year 2028. That's not including the 15 million in admin funds. So 95 million additionally that the state will need to come up with in just a few years. And we're very concerned that this would lead to the state of Iowa cutting SNAP eligibility, making other changes, And this could not, I mean, it's very likely that this would not just negatively impact SNAP. This would impact other programs that the state of Iowa funds through their HHS budget. Um, so again, this would really shifting the cost of this shifts the blame to the states to come up with these really unpopular cuts. And I think Congress knows how unpopular these massive cuts to SNAP are, which is why they're trying to do this cost shift to shift some of that responsibility and blame for the hard decisions that are going to need to come next. Check in the chat real quick. Sorry. Very quickly on the payment error rate, and I'm sorry, this is very in the weeds, but this is what would be based on what the federal government would use to calculate the cost shift. We've seen evidence in Iowa how the payment error rate can successfully be addressed. We were fined a few years back. We could use half of that fine towards system improvements. We've actually brought our payment error rate down significantly. We're now the sixth lowest in the nation. We've seen how that payment error rate can be addressed, and it's actually investing. It's investing in things like IT upgrades. It's investing in increased training and specialization for staff. Putting states on the hook for more of admin costs and potentially on the hook for the benefit costs is just going to punish poor performing states with massive penalties. I mean, this is not a $1.8 million penalty that was sort of a stick to the state of Iowa. Like, this would be a wrecking to state budgets. We've also seen a dynamic in Iowa where the state has focused so much attention on reducing that payment error rate that our application processing timeliness continues to slip. It's the worst it's been in 20 years. We have people waiting 40, 60 days to get their SNAP benefits. And if we put even more pressure on state agencies to bring that payment error rate down, because it has massive budget implications for their state, we could really see other areas of the program suffer, like application processing timeliness, and then people could be waiting to get their benefits or miss out on them entirely. Any questions on that cost shift? I will post our blog post in the chat once I'm done with this. We get more into it. That graph that I just shared, you can look at the specific year projections and everything. Another really bad policy that is proposed in this bill is expanding work requirements to older adults ages 55 through 64 and parents and caregivers of children ages 7 plus. A reminder, the ABOD time limit already exists for adults ages 18 through 54. It actually used to be 49, and then they increased that a few years ago. And basically says if you are not working 20 hours a week, you are only going to get SNAP benefits for 3 months, and then you can't get them again for 3 years. It would expand that to older adults. It actually does something interesting where they're saying they don't consider children ages 7 and up to fall under the definition of dependents for able-bodied adults without dependents, which is interesting. What this would do in Iowa, these are projections based on data from the Center on Budget and Policy Priorities. 10% of everyone on SNAP would be at risk of losing their benefits. 10% of everyone on SNAP falls into one of those two categories. And 1 of 4 households could see their benefits negatively impacted due to the expanding work reporting requirements. So if I am a single parent with a child who is 8 years old, and I lose access to my SNAP benefits, my child would still qualify for their benefits, but we know that obviously that household benefit is going to be decreased, and that means that child is also going to see less in benefits. And I want to be very clear, you can find a great kind of overview of the evidence in our blog post, but the research on this is very clear that these requirements do not improve employment or earnings for people. They just force them off the program and they leave them worse off than before. This chart on the left kind of shows we know Older adults 55 through 64 face some specific barriers to finding and maintaining employment, and especially those with lower incomes who have health barriers to work, who maybe don't officially qualify for a disability through the Social Security Administration, or maybe they're pending disability. Um, this is going to hit those folks really hard, and we can expect that people will lose SNAP benefits as a result. The next piece, kicking refugees and asylum seekers and other legal immigrants off SNAP. The reconciliation bill proposes only allowing US citizens to receive SNAP benefits. And I want to be clear, undocumented immigrants are not eligible for SNAP, but currently refugees, asylees, and other certain legal immigrants are eligible for SNAP. This would remove that eligibility. In 2023, the latest data we have from USDA, there were approximately 4,000 refugees and asylees receiving SNAP in the state of Iowa, 1.5% of all program participants. Over half of those individuals were children and seniors. And the reason I specifically bring that up is Representative Zach Nunn of Iowa's 3rd District introduced a resolution calling to protect seniors, children, and other vulnerable groups from cuts to SNAP, saying that their eligibility or benefits was not going to be changed. You can see that right here to the right. And it says an individual under the age of 19, an individual age 65 or older. It doesn't say anything about citizenship status. And I just want to make that clear. Representative Nunn's resolution said they weren't going to cut, no one was going to lose benefits that was a child or senior. That is not true for refugees and asylees. And they are just as deserving of benefits as any US citizen. They're some of the most vulnerable people in our communities, and we know they don't spend a lot of time on SNAP. They use it briefly to get their feet under. Another one that we really were not anticipating that was included in the budget reconciliation text is eliminating the SNAP nutrition education program known as SNAP Ed. States use SNAP Ed funding in a number of ways to support nutrition education programs. Here in Iowa, SNAP Ed funding runs through both Iowa HHS and Iowa State Extension and Outreach to run specific programs. Some of those I'm sure you've heard of. Programs like Pick a Better Snack, Fresh Conversations, Buy, Eat, Live Healthy. It funds specific staff positions at HHS and Iowa State Extension and Outreach, and would just be really harmful for the state. I also don't know how this necessarily vibes with the Make America Healthy Again movement. Again, this is nutrition education programs that are being proposed for elimination. Finally, freezing future updates to the Thrifty Food Plan. We were happy that they did not undo the 2021 reevaluation, which would have cut current benefits. But what is being proposed is essentially cutting future benefit amounts and freezing those reevaluations that are scheduled to occur every 5 years. There's still an annual inflation adjustment built in, but this does not take into account other changes that occur. And CBO estimates that this provision would lead to $201 million less in SNAP benefits going out to Iowans over the years of 2027 to 2034. If you hear people say this is not a cut, I would just counter. CBO says that $201 million less in SNAP benefits are going to go out to Iowa. That sounds like a cut to me. Just to kind of round this out, despite the rhetoric and what you may be seeing some members of Congress share on social media, these are not small tweaks to SNAP to address waste, fraud, and abuse. They are the largest cut to SNAP in the history of the program. They are large structural changes to the program that will cause chaos for state agencies and kick people off the program. There is not a way to cut almost $300 billion from SNAP that will not do harm. A couple of weeks ago, we were talking 230 billion. That number has gone up, almost $300 billion in cuts, 30% of SNAP's budget. And in addition to these SNAP cuts, the bill also proposes massive cuts to Medicaid, Medicare, and Pell Grants. And we know that when families lose access to SNAP and Medicaid, that can also mean children losing access to free school meals, because when families qualify for SNAP or Medicaid, they automatically qualify for free school meals. And really, the short of it is this bill takes from the poor to give to the rich. And I know I've shared this before, but this is a graphic from Center on Budget and Policy Priorities that I think makes this really clear and is kind of outdated because these cuts to SNAP are actually even larger now. But the cuts to SNAP and the cuts to Medicaid, those cuts are the same amount that was being proposed as tax cuts for people with incomes in the top 1%. CBO just had some additional information come out recently in the last 24 hours, and it makes it very clear that this would really hurt the bottom 10% of America, and it would make the top 10% much more wealthy. I'm urging you to contact your representative today. If you haven't already, even if you have, maybe if you already contacted them this morning, you're off the hook. This could come up for a vote today. It could come up for a vote Friday. It could be pushed another couple weeks. We don't know. Things are moving very quickly. They're very fluid. It's really important that you reach out to your member of Congress, your representative, and share your concerns about these massive cuts to SNAP and the harm that they will cause. We have their numbers here listed. You can also, if you go to their website, kind of submit something with a form usually. But our representatives need to hear really loud and clear that we will not stand for these cuts to SNAP and Medicaid. Also, at the same time, we need to be reaching out to our senators. The Senate, from what we've heard, is basically working on its own bill. And when the House votes on their bill and sends it over to the Senate, they're basically just going to replace it with their own bill. And so they are essentially working on their own version behind the scenes right now. We need to reach out to our senators. Both of Iowa's senators are on the Ag Committee, which means they have a lot of sway specifically on these SNAP cuts. We need to be reaching out to Senator Grassley and Senator Ernst, their ag staffers, and really pushing back hard on these cuts to SNAP, especially the state cost share and expanding work requirements to parents and caregivers of children ages 7+. We've heard those two, if we push hard enough, we have a shot at getting the Senate to remove them. So again, contact your member of Congress, contact your House rep, demand they vote no, and start reaching out to the Senate as well. Finally, I wanted to share this because I think it would be useful when you're reaching out to your members of Congress. Feeding America's Map the Meal Gap 2025 study was just released. It's 2023 food insecurity data, but this is food insecurity estimates for the state of Iowa. They have county level estimates. They have congressional district estimates. So if you're wanting, to reach out to a representative, you can look up to find the food insecurity rate in their district and the number of people experiencing food insecurity. What I will share is that in every single county in the state of Iowa, food insecurity increased in 2023. Obviously, that means every congressional district it increased as well. And I have this graph that I put together and wanted to share that shows the blue line is the number of individuals assisted by SNAP in Iowa. And the red line is the individuals experiencing food insecurity, those Map the Meal Gap numbers. And this is not a surprise to us in, I think, the sector. But you can see here how that gap of the number of people experiencing food insecurity and the number being assisted by SNAP has really gotten big over the past few years. I'm assuming it's only gotten bigger in 2020. We know that if we see these cuts to SNAP, and if more people are kicked off the program or see their benefits reduced, we're going to see food insecurity increase even more. We're going to see increased pressure on food pantries and food banks and other emergency feeding organizations. Well, maybe I will just share our next news real quick and then I'll open it up for questions on the federal side. But this is very new. We haven't put out anything in an email. This image says register today, but we don't even have the registration link out. But I did want to have a save the date for our annual meeting. It will be Friday, June 27 from 1 to 3 p.m. at DMARC in Des Moines. We are just going to be having an in-person meeting this year. We've done hybrid meetings in years past. It's just a little tricky to manage logistically. We will probably have a recording of the meeting if you can't attend and want to view it afterward, but we are not going to be having a hybrid interactive meeting this year. So please put that on your calendar. It's free to attend. We would love to see you there and help us strategize on policy priorities for the upcoming 2026 state legislative session. We would love to write some bills this year, and we want you to be a part of that. Okay, now I'm going to stop sharing and open up for any questions that people have. I saw Donna's comment and I will follow up with her. Yeah, Larry.
Yeah, a couple of things. When our payment error rate was higher, and I looked into it, my understanding was that payment error can be both overpayment or underpayment. I think a lot of people look at that figure and assume that, it was all overpayment, that people that didn't deserve SNAP were getting money.
That's a really good point, Larry. Thank you for bringing that up because the payment error rate does include underpayments and overpayments, and they're not using the overpayment rate to do the cost share. They are using the payment error rate, so that includes the underpayments as well. So when we think about states wanting to make sure they're getting exactly right, and the policy, this is a bit in the weeds. They're also eliminating the error threshold for the payment error rate, meaning that if I get $1 more in benefits than I should have, that is going to count toward our payment error rate. Right now, there's a threshold. So if it's like, I think within $40, it's not counting toward that rate. So this is going to make states be really careful when they're looking at people's applications, when they're verifying income. They're going to want to go through with a fine-tooth comb, but they don't want to cut it too much because then they might be doing an underpayment that would also contribute to the state's payment error rate. So yeah, it's really wonky, but they are not setting states up for success with this. Because even if states really try to crack down and, and then people ended up getting less benefits than they should have, that's going to influence their payment error rate as well.
Can I ask one more question? And that is that students that are foreign students at our universities on a student visa, not US citizens, are they not eligible for SNAP?
I would need to look that up. My hunch is that they are not.
Okay.
I mean, some of the rules for college students are pretty restrictive too. Like college students
Yes.
need to meet that work requirement while also attending school, and that can be really tricky. Um, Student visas, yeah, I would need to double check, but I don't believe so. I don't
Okay.
believe they would qualify. But special immigrants from Ukraine, Afghanistan, like currently those populations, which We're also talking about taking away their temporary protected status at the federal level, are eligible for SNAP. Same with refugees. So it would target more of those, legal permanent residents, refugees, asylum seekers, but probably, I don't think student visas. I could be wrong. Any other questions? I'm curious too, is anyone on the call, is their organization participating in Healthy Kids Iowa? Tom, I think Coralville is.
Yeah, I think we're moving ahead with that. I think we're still kind of figuring out what that looks like because like we talked about, there's the actual kind of like administrative side has been there hasn't been much, direction. So we'll see how it
Yeah.
works. But yeah, I think we are going ahead with it.
Yeah, we are as well, and have a long list of questions that we still don't really have the answers to. All right. Well, you all have 13 minutes that you can use to contact your member of Congress now, right? If there's no other questions, maybe we'll adjourn early. But thank you all for being here. Really appreciate it. Also appreciate you putting up with our lots of email updates that have been sending out lately, because there's been a lot going on. And you can probably expect some more from us in the next few weeks. But we can at least all take a little exhale that the state legislative session is over, I think. So, all right. Well, thank you all. Good to see you. Bye.
Thank you.